We are going to review the StatLock removal and application and a Tegaderm CHG dressing change. To begin with, we would explain the procedure to our patient and gather our supplies, which will include non-sterile gloves, a microfoam tape to secure the IV lines, a StatLock stabilization device package, and a central venous catheter tray. On top of the new kits, you will find two masks, one for the provider, that is you, and for the patient to wear during the entire procedure. We will begin by performing hand hygiene, donning our non-sterile gloves, and securing our IV lines with that microfoam tape strip. When securing your lines, you want to ensure that there's at least a one finger. You are able to slide one finger under your lines to aid in the application and removal process of your StatLock device. You will also bring extra alcohol pads to aid in the removal of the dressing as well as your StatLock device. You can begin by removing the notch tape on the bottom of the PICC dressing. You can use adhesive remover or alcohol to remove the dressing. The Tegaderm CHG dressing should be removed low and slow, ensuring that the gel pad is intact throughout the removal process. You can roll your dressing up to the top of the StatLock stabilization device. Using alcohol to help aid in the removal of the Tegaderm CHG dressing. Move again. The dressing will be rolled to the top of the stabilization device and utilize at least 4 alcohol pads to aid in the removal of each wing of the StatLock device. Begin working on one side and slowly removing and folding the wing under itself during the removal process. Begin the same process on the other side of the StatLock stabilization device. Once the stabilization device adhesive has been removed from your patient's skin, secure the PICC and open the retainer door, beginning on one side and switching hands, securing the PICC line, and open the retainer door, grasping the bottom part of the door when opening. Remove your StatLock stabilization device and begin to remove the rest of your dressing, securing your PICC line throughout. You can use adhesive remover or alcohol to further loosen your dressing. You can remove your non-sterile gloves at this point, perform hand hygiene, create your sterile field when you open up your CBC tray, and open all of the contents of your kit, ensuring to open your StatLock stabilization device into your tray. Again, perform hand hygiene, apply your sterile gloves, and use an alcohol pad to hold the line in preparation for ChloroPrep scrub. Begin at the exit site and scrub in a back and forth motion around the exit site and the surrounding areas for at least 30 seconds. Ensure the ChloroPrep has dried by allowing 30 seconds to elapse. Use alcohol preps that were opened in your kit to wipe the lumens down, 1 alcohol wipe for each lumen. Use your barrier film stick provided in your kit to create a perimeter around the window of your Tegaderm CHG dressing. Then utilize the skin protectant provided for your StatLock stabilization device, ensuring the skin protectant pad is applied to the area where your new StatLock will be placed. When all of your skin preps have dried, ensure your StatLock stabilization device, the arrows are facing up. Slide the StatLock device under your PICC device, ensuring each post is placed in the open lumens of the PICC. Close each retainer door and then remove the adhesive under the StatLock device. Center your new Tegaderm CHG dressing with the Tegaderm CHG gel over your exit site and the notch portion, the larger notch portion, towards the lumens of your catheter. Ensure the adhesion of the dressing by pressing down from your exit site and around the surrounding area by the gel. Remove the outer paper frame. Apply the provided notch tape to the area under the lumens of the catheter. To provide a seal for your dressing. Place the provided label for date and initials on the lumen and date and initial the dressing appropriately. And remove your microfoam tape strip.